We're assembled really to talk about one of the most problematic issues in healthcare. We absolutely need to get the facts right so we can take on the very complex issue of drug pricing and value.
1 in 4 patients say they have not filled a prescription because of cost. Solutions that our campaign have developed are focused on 3 main strategies to reverse soaring drug prices: transparency, competition, and value.
We must not allow the issue to be defined as a choice between innovation on one hand and affordable drugs on the other. As our campaign is proposing today, we can do and must do both. Continue to support the vital role the industry plays in research and development of new life-saving medications, while introducing market-based policies to ensure that results of such research are not priced so high that patients can't benefit from them.
We have a health plan that we offer to our associates that has over 1.1 million people enrolled in it. The bigger thing that we want to focus attention today on is some of the price increases on drugs that are not new or innovative or changing the system. Just this last week, we were looking at our data, and we study our data regularly, and we found something just extraordinary that we would not have expected. We saw 3 generic drugs that are related to pain medication all of a sudden pop up dramatically in our data. The cost per prescription went up over 1,000%. It went up from $49 to almost $600 that was paid by the plan. Now, these are generics. Our associates did not experience an increase in the amount that they paid because it's generic. They're still paying $4. But the cost to our company went up literally by millions of dollars. We also saw that in a steroid and in an insulin drug, metformin, the same kind of a thing, 100% increase.
At Johns Hopkins, we certainly understand the need to pay for and budget for innovation in medical therapy. Biomedical discovery is in our DNA. We understand that, we want that. But a $20 million variance in our budget, which is what we experienced in fiscal year 2015, has a very direct impact on our ability to invest in things like patient and family-centered care.
Prescription drug prices and costs are affecting every single person in this room. If you have health insurance, there are people within your insurance pool who are taking prescription drugs. Those costs are being passed along to you in the form of higher premiums and cost sharing. If you pay taxes, your taxes are paying for these costs and cost increases. This is not a situation that is sustainable for anyone. It's not sustainable for patients, employers, or taxpayers, and something clearly has to change. AARP members are incredibly engaged on this issue. We surveyed them earlier this year and found the vast majority of adults aged 50 plus think that prescription drugs are too high, and nearly 9 out of 10 want politicians to support efforts to bring prices down. There's a very good reason that our members are concerned. Our survey also found that 3/4 of older Americans are taking a prescription drug on a regular basis. That means that when we are talking about our members being affected by high prescription drug prices, we are talking about people who are not having a one-time cost. These are people who will be facing high costs every year for the rest of their lives.
So this is a truly bipartisan issue. That's because drug prices are squeezing small businesses, taxpayers, patients, and employers. So the question is, when is enough enough? Recently, our campaign unveiled a set of market-based solutions that we think have broad support throughout the healthcare sector. But the most important support will come from the lawmakers who can move legislation to help fix our broken prescription drug market and ensure that we can achieve both innovation and affordability in this sector.